we will now take up the disorders related to excretory system. Now, there are certain disorders which we have already discussed, like when there are certain abnormal conditions found in urine. So, those we would not take up here. We would be talking about something other than that. We have discussed this condition earlier because it comes at many places, and that disorder is known as diabetes insipidus. Diabetes insipidus is caused due to less production of ADH. So the cause is if ADH is less. ADH is anti-diuretic hormone, or which is also known as vasopressin. So if production of ADH or vasopressin is less, then the absorption of water through collecting duct and distal convoluted tubule would be less, and this would result in increased urine volume. So function of ADH we have already talked of. It works on the membrane of DCT and collecting duct and increases the permeability of the membrane so that the water can be absorbed. If ADH is less, water absorption will be less. So the symptoms which we see in this case are, number one, urine volume increases. The normal daily urine output is 1.5 to 1.8 liters. But in this case, it can go as high as 10 liters to 15 liters per day. 10 liters to 15 liters per day. And if this much of water is eliminated in urine, then that also results into one more symptom which is known as polydipsia. Polydipsia is a situation when the person feels extensively thirsty. There is complete drying of throat and the person keeps drinking all the time. So, polydipsia is increased thirst. This is what is polydipsia. And if this much of water is lost, the person would feel thirsty all the time, would keep drinking, but the chances are that the person may get dehydrated. So, there is a risk of dehydration also. Now, when this much of water is lost, there are substances which will get eliminated along with this. And in this situation, there is a risk of elimination of potassium ions from the body, more than normal. And that condition would result into hypokalemia. So, this is loss of potassium ions. So, condition is one, that is diabetes insipidus. The reason for it is reduced level of ADH or vasopressin. In this, the urine volume is going to increase because ADH would not be synthesized or would be less. And this would cause increase in urine volume. Sorry, this polydipsia is polydipsia. So, increased urine volume would result into increase in thirst, and this would cause, this is known as polydipsia. Dehydration is also a factor which can be caused, and excessive loss of calcium ions. So, this is one disorder which we can talk. The second disorder is nephritis. Nephritis is basically inflammation. Inflammation at various places in nephrons. But here, main problem which is going to happen is whenever there is inflammation and in the filtration membrane, the slit pore through which this ultrafiltration takes place, they become wider, and through which proteins would get filtered. And we have written this condition earlier when we were talking about abnormal substances in urine as presence of albumin in urine. So that condition would be albuminuria. So there would be protein which would be eliminated in urine. So inflammation is caused especially of the filtration membrane, and that would result into this loss of protein. Proteins are not normally present in urine. The third abnormal condition can be gout. Now gout is joint related. There is basically accumulation of crystals of uric acid. So uric acid crystals accumulate in joints, and because of which the joints turn extremely painful. So though it is a disorder associated with joints, because here the joints become painful and the movement becomes very, very difficult, but the reason is that this nitrogenous waste, that is uric acid, is not getting eliminated from the body, and that is why we include this condition also under disorder of excretory system. Now the next one is renal failure. Now, in this renal failure, there are two conditions. It can be an acute renal failure or it could be chronic renal failure. In acute renal failure, normally it is reversible, and in chronic, it is invariably irreversible. Now, what exactly happens in renal failure is the blood supply to kidneys and finally to nephrons decreases. If there is less flow which is taking place, then filtration would be less, that is glomerular filtration rate would fall, the nephric filtrate would be less, and it would result into a condition where the urine output is going to be less. That is known as oliguria. In oliguria, the urine volume is less, and it is about 50 to 100 milliliters per day. Now normally the urine output is about 1.5 to 1.8 liters per day, and here it has gone so low that it's hardly 100 milliliters. The condition may get even bad when the urine output is very, very less, or which we consider as negligible, like less than 50. So if urine volume is less than 50 milliliter per day, then that situation is called anuria. These are the conditions which are caused whenever there is renal failure. Less blood is going into the kidney. If blood is less, and it could be because of excessive bleeding in internal organs, or it could be hemorrhages, or it could be some kind of blockages where the blood supply to the kidney is getting lower. So less filtration will take place. Because of that, urine volume is going to decrease, and it is not going to decrease by just small quantity. From 1.5 liter to 1.8 liter, it has come down to about 100 milliliters, and it can go even lower. Now if urine output is less, that means less water, and along with it less nitrogenous waste is getting eliminated. So where is that nitrogenous waste or urea going? It remains in the body. That means blood urea level is going to increase. That condition is known as uremia, where blood urea volume increases, because normally urea should get eliminated along with urine, but if it is not getting eliminated, it remains in the body, and in the body mainly in the fluid, that is blood. That condition is known as uremia. Now, if a person is suffering from this kind of problem, then we know that urea can be accumulated in the body for some time, but at a higher level and for a longer period of time, it is going to act as a toxic substance. So it has to be eliminated. Now, such patients are treated by using an artificial kidney, which is known as dialysis machine. So, how can this extra urea be removed? There are two methods of dialysis. We'll take that up in the next part. But urea would be removed from the blood using a machine. And that machine is basically acting as an artificial kidney or a structure which is outside the body but is removing the waste from the blood. So, such patients have to undergo this dialysis on a regular basis so that that extra urea which is present in the blood can be removed. So, in the next part we'll take up dialysis and the types of dialysis.